Welcome again with us, with Alpha Sigma Group, which is the new entity after the joint venture, of course, Alpha Wasserman with Sigma Tau. So therefore, on behalf of the group, therefore on behalf of Sigma Tau Health Science, hereby I'd like to welcome all of you for our particular event this time that actually we want to share with you an amazing studies that we did. And I leave the word to Ramsey, to take this further. Thank you very much. Welcome, and I wish you a lot of success for this.
Thank you very much, Saf. It's a fantastic venue, somewhere between wine vaults and a cathedral, so I thank Sigma Tau for accommodating us in an exciting way. Now, the first speaker is Professor Ashok Agrawal from the Cleveland Clinic. And I know that Ashok really requires little introduction to an audience who understand matters of fertility. An extraordinary clinical and academic output has been Ashok's sustained over a long time. Most of us clinicians manage 10 years of sustained intellectual activity, but Ashok has managed between 20 and 30. It's fantastic. And the work that he's done and continues to do, I think has actually come of age just this year as we are beginning to recognize causes and treatments for male fertility. So, Ashok, we welcome you very warmly.
Thank you. Thank you, Professor Ramsey. Thank you, the chairmen, and thank you very much to the organizers, Sigma Tau Health Sciences. This is indeed a great pleasure for me to be here, and this is a beautiful surrounding. I don't feel like giving a talk here. I think a glass of wine probably will be the right setting for this room, but that will come in the evening anyway. So for the time being, I think we are going to spend some time talking about the science behind nutraceuticals and many of the things that has been published as well as being conducted related to both male and female aspects of nutraceuticals. So thank you again for coming here and listening to me. So I come from Cleveland, Cleveland Clinic. For those of you who are familiar, it's in the Midwest. Some people were asking, where are you coming from and where is Cleveland? So we are one of the very important town now for those who follow basketball. We just won the national championship, NBA, and for those who are familiar with that, I think we have LeBron James, one of the greatest basketball star, and it has been a wonderful last couple of weeks when there was a great celebration. After 52 years, the trophy has come, or any trophy has come to Cleveland. So it's a big thing for Cleveland as well as for Ohio. So, so today I'm going to be talking about male factor infertility, discussing about oxidative stress, and a little bit about the DNA damage, also update you on the techniques that can be used to measure the DNA damage, the relationship between oxidative stress, DNA damage, and male infertility. What are the indications or reasons for testing patients for sperm DNA damage or for oxidative stress? What are the commonly used antioxidants? And then use the evidence-based medicine approach to talk about the role of antioxidants in the management of male infertility and leave you with some take-home messages. Infertility, as we know, is growing, and specifically the male infertility, and it is something that affects anywhere between 17 to 25% of reproductive age couples. Of these, male factor infertility is considered to affect at least about 30% of all causes of infertility in a couple, and between 15 to 20% of these causes, in addition, involve both male and female. So together, it is considered up to 50% of the cases of infertility involve a male factor. And the biggest chunk of male factor infertility still remains as idiopathic, occupying as much as anywhere between 30 to 40% of all causes of male factor infertility. And idiopathic infertility could be because of abnormal semen analysis and or unexplained, which is where the semen parameters are normal and there are no female factors. So these are distinctions which are very important. So over the last several decades, we are seeing a number of studies that are coming out from different regions of the world, which are demonstrating that the semen quality is declining in different parts of the world where the study is being conducted either on normal healthy population or in infertile group of patients. There are reports, hundreds of such reports have come over the last 20, 30 years that semen quality is declining with the decline in semen count, semen volume, motility, as well as morphology. So there is a significant decline. There is also a significant rise complemented with male infertility. And the percentage of male infertility in a paper that we published recently seems to, there have not been any reports in terms of the prevalence of male infertility reported. So this study looked at the epidemiological data, which was calculated using the female infertility statistics, which are still available in many regions, and using 30% as the male factor involvement, we computed that data to put in actual number, or at least the percentage of male infertility through different regions. And you can see some parts of Europe, for example, Eastern Europe, Middle East, Africa, there is a very high prevalence of male factor infertility. So it is a worldwide problem. It is not just devoted to advanced countries. It is something which is seen as a disease in almost all parts of the world. Now we want to talk about the linkage between male infertility and oxidative stress. And to do that, you need to understand what is reactive oxygen species. Reactive oxygen species are a group of free radicals with unpaired electrons, and they are produced by all the cells at all times. When they are present or they are produced in small quantities, they are very important for sperm function. They are basically essential for many events within the sperm physiology, which prepares them for fertilization. And during the normal course of action, these free radicals are kept in check by the endogenous antioxidants that are present in the sperm cytoplasm. But as the sperm go through the cycle of spermiogenesis, they lose a lot of their cytoplasm, become elongated, and they lose the enzymes that are present in the cytoplasm of the sperm, and making the sperm very vulnerable to high amount of oxidative stress or oxidants that are produced. And another feature of the sperm cell is that they are very rich in polyunsaturated fatty acid, which are present in their plasma membrane. And because of that, they are vulnerable to lipid peroxidation attack. And because of lipid peroxidation, and in absence of sufficient antioxidant, if there is a oxidative insult, then that results in a cascade of changes that make the sperm dysfunctional by damage to various macromolecules of the cell, such as carbohydrate, protein, lipids, and nucleic acid. So this is really an important etiology that we need to understand. So it's an imbalance between the amount of oxidants and antioxidant, which include reactive oxygen species, includes reactive nitrogen species, as well as enzymatic and non-enzymatic antioxidant. And the factors that really impact or trigger the oxidative stress could be as much as accessory gland infection of the prostate or seminal vesicle, or there could be some kind of systemic pathology such as diabetes, cancer, or certain lifestyle factors that can also, like smoking or obesity, cell phone use. So there are a number of things which have been linked to generation of high amounts of these oxidants in the sperm cell, and that induces the oxidative stress. Certainly, I think this is a condition that have been studied in detail by many groups and many studies. Measuring the oxidative stress has been quite tricky over the last 20, 30 years since we have been involved in studies on oxidative stress. Back at Harvard, where I started this research, there have been difficulties in finding suitable, easy techniques to measure oxidative stress, knowing that it is something which is important in the physiology of the sperm and in the pathology of sperm dysfunction. How to measure whether the patient has abnormal oxidative stress. So there are a variety of hodgepodge of techniques that are available, or most of them have one problem or other. We have been using a technique called chemiluminescence, which seems to provide the level of oxidants when a substrate such as luminol is added to the semen. It generates light, and that can be captured by the instrument. But the device is very expensive. Also, the instrumentation requires the use of fresh semen, which limits its application, and it is time sensitive. So with number of technical problems, practical problem, the actual assay hasn't really caught up with most of the fertility lab. Recently, there is a company in US which developed this instrument called Myoxis, and it measures the oxidation reduction potential. It's a small little device, and it measures the balance between oxidants and antioxidants, which is really important in the semen. It is very inexpensive. It provides the results within few minutes, like 4 minutes, and it's very reproducible in both fresh and frozen sample, which is a limitation in most of the traditional techniques for measuring oxidative stress, either lipid peroxidation. So something for clinicians and laboratory personnel to consider is the use of this instrument, which has become available now in the market, and they have a booth in ASHRAE. So now we know oxidative stress and what it is and how we can measure. Let's move on to another functional characteristic of the sperm called sperm DNA damage. And what is sperm DNA damage? It's basically sperm chromatin, which consists of DNA and protein, and majority of it is histones, which are replaced by protamines. And the sperm DNA is really condensed in a very compact form in the nucleus so that it is stable during its transport to the female genital tract. So this is the sperm chromatin. And the damage to the DNA is a number of events that occur during the process of its movement from male to female that can cause various kinds of changes in the DNA, which is a double helical structure. And these really result in single strand break. It can result in double strand break, or it can result in a small nicks and ligation. So together, any of these changes can be constituted as DNA damage. They are not one type of damage, and some are more serious and have more consequence than others. The causes of DNA damage in male factor infertility are numerous. There are so many different things that can cause the DNA damage to occur. There are xenobiotics, the lifestyle exposure to various types of chemicals which are present in the environment. There are high level of radiofrequency radiation. So there are a number of things in addition to oxidative stress which can trigger DNA damage, also the apoptosis. So the DNA damage sperm can fertilize an oocyte. Oocyte has its own enzyme to repair the damage to the DNA. However, sometimes it is not sufficient to actually to repair that damage, and because of that, there are a lot of problems in terms of IVF, that they will have abnormal development, failed implantation, miscarriage, and abnormalities in the offspring. So the key is, if the damage is very small, most of the time oocytes should be able to repair it, but many times this is not possible. And these are the consequences which have been studied in a number of studies which have been published in the literature. So the DNA damage is critical, and many of you are familiar with it. Over the last 10 years, hundreds and hundreds of reports have come out. People are looking for a sperm function test which is meaningful, which provides the answers to the patients who are having repeated IVF failure, patients who cannot be really diagnosed as to what is the problem with them, miscarriages, repeated implantation failure. So this is the main reason that the study of DNA damage has become very, very important. In absence of other useful markers of the sperm function, and in presence of high number of patients after IVF ICSI failing to really become pregnant or having recurrent pregnancy loss, we're looking at what is the role of DNA damage and how the DNA damage actually is impacting these types of problems in the female. So number of studies have been conducted, and this slide shows a meta-analysis that was published based on a large number of studies. And the main message here is that the sperm DNA damage is highly correlated with pregnancy loss. As you can see from a number of studies, this is still an old slide. Since then, a large number of other studies have come in the literature, and the message is the sperm DNA damage has an important role. And you can look at some of the evidence in the slides now in terms of the IUI. Again, the DNA damage has been shown to play an important role if the samples have a high amount of DNA damage. For example, using the tunnel technique, there will be no pregnancy in the study that was published. Or if they have a borderline, again, they may have a miscarriage. So similarly with the live birth rate, there is a huge difference between the consequences of a patient having high amount of DNA damage in normal as well as in elevated group, as you can see in the bar diagram. Studies which have been published on DNA damage in ART also show that patients with high amount of DNA damage measured by sperm chromatin structure assay, which is one form of testing for DNA damage, with a cutoff of 30% as abnormal and above, there is a significant decline in the rate of pregnancy. So high DNA damage does not exclude that the patient will not get pregnant, but the pregnancy rate goes down almost 50%. So this is also important to know. So again, if you look at the meta-analysis that was conducted by Bungam et al. In about 3,000 couples, there is a clear evidence, especially that increased miscarriage in couples undergoing IVF ICSI with a high amount of sperm DNA damage with a risk ratio of 2.16. So there has been, and it's very difficult to select the sperm with a great degree of accuracy which do not have the DNA damage when performing ICSI. There are a number of methods that have been used in the literature to measure the DNA damage. There are direct techniques such as tunnel, indirect techniques such as sperm chromatin structure assay, sperm chromatin decondensation or COMET. So there is a lot of choice, but certainly I think each technique has some advantages or disadvantages. This is the technique using a sperm chromatin structure assay, where the threshold of DNA fragmentation is about 30%, and the tunnel, which is another technique, which is a direct technique, which really measures the true single and double strand DNA fragmentation by directly incorporating modified nucleotide into the site of damage. And we have been using a standardized protocol that we have developed and have really tested with one of the sister laboratories in Switzerland, using similar instrumentation, similar protocol, and taking the samples which we shipped, and they shipped back to us, and we have optimized the settings. And the best part of this instrument is called a benchtop flow cytometer. It is certainly a little bit expensive, over $50,000 US, but the advantage is that it can be conducted, the test can be conducted in your own laboratory, unlike sending it to another lab where you really don't know what the results are coming. And it measures 10,000 sperms, so the sensitivity of the technique is very high, unlike many other simpler techniques which measures like 200 sperm or 300 sperm. So the accuracy of those tests is very, very poor. Now let's talk about the antioxidants. They are enzymatic antioxidants, which are not found in the supplements that are available or marketed. They are superoxide dismutase, there are catalase, and then there are non-enzymatic antioxidants which interrupt the free radical chain reaction. And examples are carotenoid, vitamin C, E, and polyphenols and glutathione. And these are the antioxidants that are found in supplements and food and are non-enzymatic. And they provide the support to enzymatic antioxidant by really removing the free radicals. Sorry about that. Now let's talk about the rationale for oral antioxidants in male infertility. So antioxidant can be classified according to their mechanism as catalytic, which enhance the already present antioxidants, such as glutathione or N-acetylcysteine, or scavenging antioxidants, such as water-soluble, react with the oxidant, and lipid-soluble, which protect cell membrane from lipid peroxidation. Now, the importance of antioxidant in treating the male infertility, it is very important to recognize, as I said, almost as much as 40 to 50% of patients with male factor infertility are grouped into the class of idiopathic or unexplained infertility. For them, there has to be some kind of treatment, and I think in various types of pharmaceutical agents and antioxidants have been tried in an empirical manner, but we are going to talk how this can be really done in a much better way. So the advantages of antioxidants have been reported in the literature in a number of studies. These are studies that have been conducted in the laboratory by a number of investigators over all over the world and published. So we know that antioxidants have a beneficial role in improving the sperm function, as well as also improving ART outcome. The main oral antioxidants that are there are compounds such as ascorbic acid, alpha-tocopherol, vitamin E, lycopene, astaxanthin. Catalytic are carnitine, selenium, pentoxiflane, coenzyme Q10. And when they are given in combination, they are much more effective because of the synergistic effect of these compounds. So it is important to recognize that the antioxidant treatment, if it is given in combination with other agents with synergistic action in correct dose, they can be much more beneficial than given individually. And let's look at few studies which examined the effects of antioxidants in vivo. So this is one of the study. We still don't have too many studies, but the evidence is gradually growing with the studies that are coming out. This is looking at vitamin C and vitamin E and glutathione for 2 months, and it reduces the marker for DNA damage significantly over a course of 2 months, which is, I believe, is a short period of time. The ideal dose should be at least 2 cycles of spermatogenesis. This is another study which was done by Dr. Greco, where daily oral supplementation of vitamin C and E for 2 months reduces the number of sperm with tunnel positive which were tunnel positive. So there is a significant decrease in DNA damage to sperm by having the patient undergo antioxidant supplementation. There are other studies which looked at 1 gram per day of vitamin C and E for 2 months. It improves the ICSI outcome. The coenzyme Q10 is a placebo-controlled study for 26 weeks of 106 OAT or oligosteatoteratosphermic patients. It resulted in improvement in all the semen parameter. As shown here, at concentration of between about 200 milligrams per day for about 6 weeks or 6 months. And here there is also a significant improvement in the spontaneous pregnancy rate in these group of patients who were treated with coenzyme Q10. So let's now examine the controversy which impacts the antioxidant supplementation. There is a great deal of controversy and skepticism over use of antioxidant. When you talk to the clinicians, you will see that many of them feel that the antioxidant treatment really doesn't work. And there is a reason for that. And I think the reason why it doesn't work is because most of the literature is filled with all kinds of studies. And certainly the poor patient selection is one of them. Patients have some other kind of conditions which probably will not be amenable to treatment with or supplementation with antioxidants, use of single agent rather than combination, improper dose or length of treatment or other kind of condition. And because of all these controversies, Cochrane group, which is a very respectable organization, did this meta-analysis called Antioxidant for Male Subfertility and published it in 2011. So those of you who are familiar with it or not should look it up. And this particular meta-analysis examined 34 randomized controlled trial involving approximately 3,000 couples. And the study evaluated the effect of oral antioxidant for male partner of couple undergoing assisted reproductive treatment. And the pooled finding of this particular report shows that there is a significant increases in live birth and pregnancy rate with the use of antioxidant by the male partner. The semen parameter, on the other hand, did not show a substantial increase. And this is very important to recognize that these studies that were included as part of the meta-analysis were not standardized. They were all done in different ways using different antioxidant, different types of patients. So despite all these dissimilarities, still the evidence is very strong in favor of the use of antioxidant for male subfertility. If we know there is an antioxidant that has to be used, so then we need to diagnose what is the underlying cause, whether it is varicocele, whether it is infection, lifestyle factor, what is really leading to the oxidative stress, and whether the antioxidant are really the treatment of choice, differentiate if it is coming through the infection, the high amount of oxidative stress, or is it generated by the sperm, and the treatment modality is different. In patients which have infection, the infection needs to be treated first rather than giving the antioxidant, and then there is a choice of antioxidant that can be employed. There are number of antioxidants that are there, and their functions have been described in number of studies which are summarized here, and the appropriate dosage, and you can see this table summarizing a number of antioxidants and the type of function that they have. Proxeed Plus is one of such antioxidant formulation which has L-carnitine, acetyl-L-carnitine, fructose. It has selenium, coenzyme Q10, vitamin C, acetyl-L-carnitine, zinc, folic acid, vitamin B12, and acetyl-L-carnitine. And these are the concentrations of these ingredients which each sachet contains. So now let's talk very quickly about the oxidative stress and female reproduction, as there will be two talks which are going to elaborate on the role of oxidative stress in female reproduction and the role of nutraceutical. In terms of the female, oxidative stress have been actually implicated in almost all the female reproductive conditions such as endometriosis, tubal infertility, PCOS, abortion, embryopathy, and unexplained infertility. And Proxeed woman product, which is available, is designed to improve the possibility of pregnancy. It improves the processes associated with the actual fertilization. And these are the ingredients of Proxeed woman. Again, L-carnitine, L-arginine, et cetera, et cetera. And how does it work? It's basically these ingredients have a role in terms of supporting the oocyte quality and restores the energy balance, reduces oxidative stress, supports normal hormonal cycle. And all of these together actually help increase the chances of conception. You will hear from other speakers this afternoon about the science behind these, so I'm not going to really go into that. That will be covered by other speakers. Then the female sexual dysfunction is another area where at least 45% of women have at least one sexual dysfunction at some point. And there is a compound such as L-mucil, which is a food supplement designed to support female sexual dysfunction. This product actually addresses the physiological and psychological mechanism involved in female sexual dysfunction. And these are some of the ingredients of this particular product. And again, the mechanism behind this, which will be discussed in a more detailed scientific manner by other speaker, is captured here. So let's talk about some of the clinical scenarios, especially in terms of what are the right patients, and we are focusing more again on the infertile men who are candidates for antioxidant supplementation. These are some of the case scenarios. This is a normal healthy man and wife is normal, but the important point here, which is highlighted, is that the patient has a left grade 3 clinical varicocele, and he had 2 semen analyses which seem to have poor concentration, motility, and progressive motility. Also, the morphology is abnormal. The hormonal evaluation is also normal. The advanced pump function test revealed that the levels of reactive oxygen species are increased. Also, the antioxidant level in the seminal fluid is significantly lower. So this is one of the candidates where antioxidant supplementation, either before the surgery for varicocele, which is important to be done, or after the varicocelectomy, will be very helpful. So this is one case. Again, another case which the most important condition here is the sexually transmitted disease or infection. So all other scenario looks normal. The semen analysis comes out to be completely normal, but the most important point here is the presence of infection or the presence of pus cell or white blood cell as measured by peroxidase staining test. So this patient again will be a good candidate for antioxidant supplementation. This is case number 3, older men. Advanced age is a risk factor for male infertility. And in this, again, the other risk factor is this history of smoking, and occupational risk factor is working in a paint factory. So these are, again, where the semen analysis results are all normal. The levels of advanced sperm function test are showing abnormal results with oxidative stress, ROS and TAC. So that will be another case where antioxidant supplementation will be important. This is the 4th case where this is an oligoasthenoteratospermic patient who underwent IVF and failed. Other examination was normal. The semen quality was highly abnormal, as you can see by semen analysis. So these are, again, cases where we suggest antioxidant supplementation will be beneficial. So to summarize this, what patient perhaps may be benefited by treatment with antioxidants or advised antioxidant supplement for male infertility. And these are patients with poor sperm motility or OAT or oligosteratospermia before they are undergoing ART treatment. Patients with failed IVF or ICSI, which is in a big group of patients which are failing. As we all know that ICSI is not a miracle for each and every patient. There is a large number of patients which fail ICSI. Varicocele and OAT prior to surgery. Idiopathic or unexplained infertility is another group of patients. Patient with lifestyle risk factor, advanced age, smoking, obesity. These are various conditions which are important. Previously failed pharmacological treatment with other agents. So these are group of patients where we feel that antioxidant supplementation can be conducted. It's probably more appropriate to recommend that. And that should be prefaced with first these patients should be diagnosed with measuring the level of oxidative stress using a standardized approach and then led to the treatment with antioxidants. So if we want to summarize the role of oxidative stress, this is a good slide to look at how it impacts on both the male and female, resulting in damage to the DNA, tissue damage, mutagenesis, etc. in the male, declining semen quality in the female, delayed conception, decreased fertilization, and many of the other factors, increased loss of implanted embryo, resulting in decreased pregnancy outcome. So the take home here from my talk is that future studies, and we need a lot of studies for sure, that there is still a shortage of good studies. It's difficult to conduct clinical trials, so I want to, I'll recommend many of the speakers who will be coming after me, who will be providing some new data. They should have, the studies should have a pregnancy outcome as their primary endpoint and should be adequately powered. If we have only 10, 20 patients, I don't think that really provides convincing evidence of the effect. So thank you very much. I really appreciate talking to all of you today. Thank you.